Diabetes often goes undetected for years until serious complications show up, but there are warning signs your body might already be sending. Today, we're covering 7 subtle symptoms you should never ignore. If you're serious about your health or know someone at risk, like this video and subscribe for more crucial health tips and early warning signs you need to know. 1. Constant thirst that never seems to end. One of the earliest and most overlooked signs of diabetes is persistent thirst that never seems to go away. You may find yourself drinking large amounts of water throughout the day, but still feeling dry and parched. This excessive thirst, known medically as polydipsia, happens because high blood sugar levels pull fluids from your tissues. Your body tries to flush out the excess glucose through urine, leaving you feeling dehydrated. Even if you drink more than usual, the dryness lingers and prompts frequent trips to the bathroom. Many people dismiss this as a result of a hot day or physical activity, unaware of the underlying issue. It is easy to normalize this symptom and assume it is harmless or temporary. However, if you are constantly refilling your water bottle and still feel thirsty, it could be a red flag. The body is working overtime to eliminate excess sugar, and thirst is one of the first warning signs. Ignoring it may allow the condition to worsen quietly over time. This ongoing need to hydrate without relief can become a daily frustration. 2. Frequent urination that disrupts daily life. Another subtle but significant sign of undiagnosed diabetes is frequent urination that disrupts your daily life. If you notice you are running to the bathroom far more often than usual, especially at night, pay attention. This symptom, known as polyuria, occurs because the kidneys are trying to remove excess glucose from the blood. In the process, water is pulled along with the sugar, leading to increased urine output. You might think it is due to drinking too much or a side effect of medication, and that is often assumed. However, if the urge to urinate interrupts your sleep or daily activities, it could be a deeper issue. It is especially concerning if you urinate multiple times during the night, affecting your sleep and energy. Over time, this frequent urination may lead to dehydration, making the body feel even more unbalanced. Many people live with this symptom for months before connecting it to blood sugar problems. You may feel embarrassed to bring it up with a doctor, assuming it is normal or age-related. But when paired with other warning signs, it paints a clearer picture of a potential problem. Listening to your body's signals can help you intervene before serious complications arise. Early testing and lifestyle adjustments can make all the difference in prevention and control. 3. Unexplained weight loss without dieting. One particularly sneaky symptom of undiagnosed diabetes is rapid or unexplained weight loss without any effort. While many people celebrate sudden weight loss as a benefit, it can actually be a dangerous warning. When the body cannot use insulin properly, it is unable to process glucose for energy. As a result, it starts breaking down fat and muscle to compensate, leading to unexpected weight reduction. This process can cause you to lose pounds even if you are eating normally or more than usual. If you are not dieting and still losing weight quickly, it may be time to investigate further. People with early diabetes often report clothes fitting loosely or seeing a change in their face and body shape. Unfortunately, the weight loss does not come from healthy fat burning, but from the body's inability to function correctly. This can lead to fatigue, muscle loss, and a weakened immune system over time. What seems like a welcome surprise might actually be your body's cry for help. Rapid weight loss should never be ignored, especially when combined with increased hunger or fatigue. Checking your blood sugar levels can help identify whether glucose imbalance is behind the issue. When caught early, this symptom can be reversed through proper treatment and lifestyle changes. 4. Blurred vision and eye strain. Blurred vision is another early sign of diabetes that many people overlook or blame on aging or screen use. When blood sugar levels are too high, they cause fluid to move in and out of the eye's lens, affecting focus. As a result, your eyesight may suddenly become blurry, or you may struggle to read fine print clearly. This can happen in one or both eyes and may come and go, making it easy to dismiss. Some people also experience eye strain, headaches, or difficulty adjusting to light. If left untreated, chronic high blood sugar can damage the blood vessels in the eyes, leading to permanent vision loss. This condition, known as diabetic retinopathy, is a leading cause of blindness in adults. Most people do not associate these vision changes with a metabolic issue like diabetes. They may buy new glasses or avoid reading, unaware that the root cause lies in blood sugar fluctuations. Paying attention to how your vision changes, especially if it is sudden or persistent, is essential. Blurry vision is not just a symptom of poor eye health, but could be your body's way of warning you. Regular eye exams and blood tests can help detect these changes early. Early detection and blood sugar control are key to protecting your long-term vision. 5. Tingling or numbness in hands and feet. Tingling, numbness, or a burning sensation in your hands and feet could be an early sign of nerve damage caused by diabetes. Known as diabetic neuropathy, this symptom develops when prolonged high blood sugar harms the peripheral nerves. It may begin as a mild tingling or strange sensation, often in the toes or fingertips. Over time, it can escalate into pain, weakness, or complete loss of sensation in those areas. This can affect your ability to balance, grip objects, or walk safely without stumbling. Many people confuse this with poor circulation or temporary pressure on nerves from sitting too long. However, if the sensation is persistent and affects daily comfort or movement, it may indicate something more serious. People often adapt to the numbness and delay seeking help, unaware of the silent damage occurring. This nerve impairment can progress silently, eventually making wounds harder to feel or heal properly. For those with diabetes, small cuts or blisters on the feet can turn into serious infections if not treated. Catching neuropathy early allows for treatment and blood sugar control to prevent further nerve damage. Tingling that does not go away should never be ignored or dismissed as unimportant. Listening to your body's signals is critical to stopping the damage before it becomes irreversible. 6. Extreme fatigue without a clear cause. Feeling drained and constantly tired, even after a full night's rest, could be an early symptom of diabetes. Fatigue related to blood sugar imbalance goes beyond normal tiredness or feeling worn out. It is a persistent, deep exhaustion that affects concentration, motivation, and mood throughout the day. When the body cannot properly convert glucose into energy, your cells are left starving for fuel. This energy gap creates an overall sense of sluggishness and mental fog, even when you are well rested. You may find it harder to complete daily tasks, stay focused at work, or keep up with physical activity. Often, people attribute this tiredness to age, stress, or poor sleep, never considering an underlying health issue. But when energy levels continue to drop with no clear explanation, it is time to investigate further. The fatigue of diabetes can also contribute to emotional strain, irritability, or depression if left unaddressed. It is a symptom that slowly chips away at your quality of life and overall well-being. The good news is that proper diagnosis and blood sugar management can dramatically improve your energy. If you are constantly running on empty, even with enough rest, it could be more than just a busy lifestyle. Your body may be signaling that something deeper needs attention and care. 7. Slow healing of cuts and bruises. If you notice that small cuts or bruises are taking unusually long to heal, it may be an early sign of diabetes. High blood sugar can impair circulation and weaken the immune system, making the healing process slower than normal. Minor wounds that once healed quickly might linger for days or weeks without improvement. You may also notice that bruises form more easily and stay visible longer than they should. Infections may develop in areas that are slow to recover, particularly in the feet or lower legs. People often ignore these signs, chalking them up to aging or a temporary immune response. However, poor wound healing is a serious concern that can lead to complications if diabetes remains undiagnosed. The reduced ability to heal is linked to impaired blood flow and nerve damage that disrupts normal skin repair. In extreme cases, untreated wounds can turn into ulcers or lead to amputations if infection spreads. Early detection of this symptom can prevent such serious outcomes and restore your body's natural healing ability. Taking note of how your skin responds to injury is a simple but powerful health check. If cuts, scrapes, or bruises are not healing like they used to, a blood test may be a wise next step. Awareness and early care can preserve your health and prevent long-term damage. Early detection can make all the difference. Have you noticed any of these signs or know someone who should see this? Let me know in the comments. And if this video helped raise your awareness, Don't forget to hit that like button and subscribe for more life-saving health info, wellness tips, and signs your body might be trying to tell you something. Stay informed and stay healthy.